Today in this lecture, we will talk about the estimation of renal plasma flow, or the estimation of the volume of plasma that is delivered to the kidneys per minute. And from the amount of plasma, then we can calculate the amount of blood that is supplied to the kidneys per minute. Now, to calculate the renal plasma flow, we need a substance which is completely cleared, or at least we assume that it is completely cleared. Simply, if the amount of a substance that is delivered to the kidney, to the nephrons, is completely excreted outside in urine, then we can say that it is completely cleared. Now, in such a case, if a substance is completely cleared from the plasma, it simply means that the clearance of this substance is directly equal to the renal plasma flow. If we calculate the clearance of this substance, we can directly calculate the renal plasma flow from the clearance of that substance. Now, we do not have a lot of substances that are cleared 100% from the kidneys, but we have one substance which is the para-aminohippuric acid PH, which is cleared around 90%. Now, if we see that this renal plasma flow is the delivery and the clearance is the excretion, this is the deliver, this is the substance delivered, and here it is excreted. Now we can say that the delivery of a substance is the product of concentration of that substance in the plasma into a renal plasma flow, and the delivery or the excreted amount is equal to the concentration of that substance in urine into the volume of urine formed per minute. Now, this is the equation which we have used multiple times in our previous lectures as well for the calculation of renal clearance and creatinine clearance as well. And the same equation is being used to calculate the renal plasma flow as well. But simply we are assuming that a substance is completely cleared, and in this case, its clearance is also equal to the renal plasma flow. So the renal plasma flow is equal to the clearance of that substance, and the clearance is calculated by concentration of that substance in the urine excreted into the volume of urine formed per minute divided by the concentration of that substance in the plasma. Now we have discussed that we have only one substance, the para-aminohippuric acid, which is excreted, which has a clearance of around 90%. So we will use para-aminohippuric acid to calculate the renal plasma flow. And in this particular example, we have calculated, we have assumed, for example, that this concentration of para-aminohippuric acid is 0.01 milligram per ml in plasma. The concentration of para-aminohippuric acid is 5.85 milligram per ml in urine, and the volume of urine formed per minute is 1 ml per minute. Now, if we put these values here in this equation, 0.01 in here, 5.85 here, and 1 here, we get a value of around 585. We get value of around 585. Now, we discussed that para-aminohippuric acid is only 90% excreted. It is only 90% excreted. 10% of para-aminohippuric acid also still remains in the plasma. So we assume there is an extraction ratio which is 90%. For the para-aminohippuric acid, it is 90% removed from the plasma, so its extraction ratio is 90%. Now, this 90% extraction ratio is in the normal circumstances if the kidneys are functioning very well, if there is no disease. In case of any problem, any disease affecting the kidneys, this extraction ratio will decrease, and then the clearance of PAH will also decrease. To calculate the extraction ratio, we calculate the para-aminohippuric concentration in the arterial blood that is being supplied to the kidney, and the para-aminohippuric acid concentration in the venous blood that goes out, and then we divide the value by amount of para-aminohippuric acid in the arterial blood. So we subtract the amount of PAH remaining in the venous blood, because 100% is coming to the kidney, 90% is excreted, and 10% remains in this venous blood. And how we know that this is 10%? By calculation of the pH in the arterial side and pH in the venous side. How exactly we take the blood from the renal artery, from the renal vein? These are experimental. These are experimental things, and we are not going into the details of these things. What kind of machinery is used? What kind of techniques or surgeries are used? But we are just discussing the end result, that how it is done. There may be other methods in the modern era which may calculate this, but we are not discussing anything else. We are just focusing on this topic to keep it simple. So, by subtracting the amount remaining in the venous from the amount in the arterial side, we can calculate the extraction ratio. And in this para-aminohippuric acid example, the extraction ratio becomes 0.9. Now, to calculate the actual renal plasma flow, this was renal plasma flow due to the 90% clearance of pH. To calculate the actual renal plasma flow, we divide this 585 by 0.9 and we get 650 ml per minute. Here, the renal plasma flow was 585 ml per minute, 585 ml per minute, but the actual renal plasma flow comes out to be 650 ml per minute. Now, this is the plasma that is flowing through the kidneys per minute. If we want to calculate the total blood flow, because the blood also contains some cells, the plasma is the component which is not containing the red blood cells, for example. So to calculate the total blood flow, we take into account this equation. This 0.45 is the hematocrit. This hematocrit is the amount of cells. This is the amount of cells. Hematocrit is calculated by the component that is made of cells, especially the red blood cells. So by dividing the 650 by 1 minus 0.45, and this equation comes from the hematocrit value, we get a figure of 1182 ml per minute, and this is the total amount of blood that flows through the kidney in 1 minute. So this is more than 1 liter of blood that is flowing through the kidneys in 1 minute, and that's how it is calculated. So this is a big amount of blood. This is a big volume of blood that is circulating through the kidney per minute, and it makes sure that clearance of all the dangerous substances, the toxic substances, occur and they are excreted in the urine. So to properly understand this video, you need to watch it 3 to 4 times, because I was not able to understand it easily, and I had to read it so many times. So you watch it few times and you will understand it easily. Thanks a lot for watching the video.